My name is Craig Butt. I'm a data journalist at The Age. I specialise in turning data into stories, whether that's articles or visualisations or interactives or maps. I also work at the University of Melbourne teaching data journalism. Today I'm going to talk a little bit about working with coronavirus data. I think one of the main challenges with working with this data so far has been the fact that the information that we're getting has been changing. We started off by getting just information on the number of new cases and the running totals, but gradually there's been more fine-grained detail that's been coming out, such as the number of recoveries, the number of tests that have been carried out, the number of people who have been hospitalised, the number of people who have ended up in intensive care units, the number of people who've died. So over time, there's been more data that's been coming out. I think the most important thing to remember is that the data isn't something that just gets generated automatically. There's a lot of work that goes into compiling this data each day. For example, the information on new cases. In order for someone to show up as a new case, they have to go to the monitoring station or their GP, get the test. Those results have to be logged. They have to get a positive result that has to be entered into the system. And then that information has to be collated over the course of a day. So in some ways, the number of new cases is determined by the amount of testing that's going on, that people are going out and getting tested, and that all those results are being collated. The testing criteria in Victoria was expanded, and so originally, I think from memory, you had to have been overseas or in contact with someone overseas or in a high-risk group in order to be able to get testing. But gradually those criteria have been relaxed so that it's much easier for the government to be able to keep track of people who have picked up the disease through community transmission. I think in terms of conveying the information about coronavirus and the numbers for Victoria, I think I found that graphs have been a very effective way of doing this, particularly time series graphs where you can sort of chart how things have changed over time. Because I think that has been front and centre for people's concerns at the moment. Typically people want to know, how many new cases have there been confirmed today? This is something which you can express, in writing by saying that, the number of cases has increased by X to be Y today. But I think having the graphs that are quite simple graphs in the story, I think that can be very effective because people have a pretty intuitive understanding of these. And a lot of these graphs are very simple. They're line graphs or bar charts or column charts. People are pretty much used to as well. So there isn't that kind of instruction manual to have to interpret complicated information. Probably one of the most recognisable charts that's been shared quite widely is the log chart that compares countries' incidence of coronavirus over time. I think this was a graph that was originated by the Grattan Institute, and I think it was picked up independently and used by the Financial Times. They've been putting out these graphs every day, and they are kind of becoming the sort of thing that a lot of people are checking first thing in the morning so they can see how the slopes of these countries have gone, whether the curve of the country is sort of going up quite high or whether it's beginning to flatten out. And it's quite curious, I haven't seen many charts that have a logarithmic y-axis before. They're pretty much unheard of until this whole pandemic, but now they're kind of quite widespread. But I think some people still come to me and ask, how does a log chart work compared to a linear chart where you've got a much more regular set of axes? And so I've got a couple of visual aids here because I've had to explain this to some colleagues. Essentially, a lot of charts are usually done with a linear scale. So I've got this ruler here where, each of the tick marks is a new centimetre. And so, the difference from 0 to 10 centimetres is the same from 10 to 20, 20 to 30. A log chart, as you go up sort of vertically, the actual amount that goes into each increment can change as it goes up. It's instead of going up in linear regard, it's sort of going up in factors of 10. So the amount that you're going up from, say, here to here is about a tenth of what it would be when you're going up from here to here, and then it goes by times 10 again. The analogy I like to use, it's kind of like a measuring cylinder, where, if it's not a complete sort of cylinder, it's got a bit of, not as wide at the bottom as it is at the top. And it kind of works the same for logarithmic charts as well, in that at the bottom of the cylinder there's less capacity than higher up. And so if you're looking at a log chart, you'd be looking at something that was far more accentuated than this measuring cylinder, where you'd start with where essentially when you go up, say, this higher, you'd end up having with 10 times the capacity and then 10 times higher up here like that. And so the reason why we use logarithmic charts is because the rate of change in infectious diseases doesn't sort of go with a kind of linear curve that you tend to see in a lot of different types of data, such as currencies and that kind of thing. It has a more exponential curve to it, which means that the numbers are gradually doubling or tripling, or at least they were in the early stages of the outbreak in Australia. And so for these types of charts, because the increase sort of happens quite suddenly, with exponential growth, you don't really notice it until it starts to get really huge. It goes from, for example, 2 to 4 to 8 to 16. And then, after a while, it's in the thousands. And so typical kind of linear charts don't really capture that rate of growth. What ends up happening is that you just see a very small kind of line and then a sudden kind of uptick, which doesn't really tell you that much. So adjusting the curve to a logarithmic curve means that you can much sort of closer see that sort of growth. And I think with the charts that we've seen so far that have that kind of comparisons for different countries, you can see that when there's a country which is going up almost sort of 45 degrees, it's having a really big increase in the number of cases, and they might be doubling or tripling every 2 or 3 days. If you are looking at like it would be a linear graph, you might assume that something that's sort of twice as high up the chart has twice the number of cases. But in fact, it's on a much higher factor than that, just because, as I sort of spoke about before, sort of the tick marks along the side and the amount of actual the amount that's sort of going in to each threshold is sort of going up by factors of 10 rather than in sort of linear increments. I think the most important thing to keep in mind when deciding whether what you've noticed is a trend or whether it's sort of got some other explanation is to really have a look at both the increases or the changes in the numbers, but also whether there's been a change in the testing as well. I think sometimes what we see when there's been an increase in the number of cases might not necessarily be correlating with an increased incidence of coronavirus. It could be that there's been an increase in the amount of testing or widening of the testing criteria, which means that some people who might have slipped through the net previously are now being captured in that data set. Not all countries have been sort of testing at an equal kind of per capita level. There's some countries that have been very good with making sure they're testing very widely. There are others where they haven't been running that many tests. And so for some countries, a positive result only comes when someone presents at an emergency department in a really bad state. Whereas other countries, they've been able to diagnose the cases a lot sooner along the way. And so it ends up meaning that you do have some sort of skews in different countries' data when it comes to coronavirus. So I think in Australia, all the states and territories have very high per capita testing rates. And so as far as I know, we're not seeing any really big gaps in terms of the level of testing that's going on. I'll go over a few examples of some of the work that I've been doing lately. So I'll start off with this article, which is looking at the coronavirus numbers for Victoria. And I'll use a lot of charts in the article too to really help to illustrate some of the trends and to really show how things have been changing over time. And I think what sort of comes through is you sort of see how there was a really big increase in the early days of late March to early April. But since April, the numbers of new daily cases has been beginning to drop off and have actually been outweighed by the number of people who've been making full recoveries. For example, here you can see the number of daily cases that have been confirmed and how those really peaked at the end of March, where there was about 100 or more cases confirmed in a single day, down towards later in April. As the outbreak has gone on, I've kind of been updating the charts in this, adding new data points to them, but also I've been adding new charts to the mix as well once we get more data, and also once sort of what we need to be expressing with the data has changed. So for example, in this chart here, you can see the running total of the number of cases, the number of people who've recovered and the number of people who've died. And so I've sort of reconfigured this data here to show the total number of active cases at any one time. So what we can see here is that the number of active cases kind of was surging in the late March period, I think reaching a peak of about 622 active cases. Pretty much every single day in April, the number of new cases that have been added have been outweighed by the number of people who've made a recovery, so that the number of active cases has been slowly decreasing. And also a map here that shows where you can kind of have a look at your area and find out how many cases have been confirmed since the beginning of the outbreak. And just some other examples of some work that I've done that's non-coronavirus related. This is the Schools That Excel project, which we've been running for about 2 years now. So it's the second year where we look at school performance over the last sort of 10 years and allow parents and readers to really see how a school has been going and whether that's been recording an increase in performance or if it's been improving, or really just sort of how it's been going. I was also involved last year in quite a big project that we ran called the Invisible Crime Project, which was looking at sexual violence and the trends on a national and Victorian level. This was the project that was really spearheaded by largely the video team of The Age, so Rachel Dexter, Eleanor Marsh, and Nicole Priesel. I really helped out with the data side of it in terms of sort of helping to pull together the data and have a look and make sure that we were looking at the data in the sort of the correct way and that we were presenting the information in a way that wasn't going to give people the wrong idea. And so my main sort of contribution to this, I think, was probably the longest article I've written for The Age in my whole 8 or so years here, which was this sort of about the data, which is about 5,000 words in total, which was really essentially an extensive sort of about, sort of went into the sort of the caveats and the methodology that we used in doing those stories, just so people would know that the numbers that we were using were accurate and the way we'd gone about it was there, and that we were kind of listing any kind of uncertainties of the data, because I think a big part of data journalism isn't so much being able to understand the numbers and being able to be good at maths. It's often about being able to understand exactly how that data is put together, how it's measured and how it's gathered, and those kind of logical things that go into the analysis of it, so you can be certain whether you're seeing an increase in incidents or whether you're seeing better reporting, or maybe there's something that's wrong with the data that you're missing out on. Finally, these are sort of things that I think everyone should know about statistics, because a lot of statistics isn't really complicated stuff and it's not really heavily mathematical. A lot of it is common sense and just sort of thinking through the data. And so this was an explainer I put together what looks at things like the mean, the median, rates versus real numbers, issues with sort of with confidence intervals with polls, and correlation and causation, and those types of questions that come up a lot of the time with data. So things that you might have encountered back when you were doing, year 10 maths, which probably seemed a bit untethered from the real world, but which really in journalism in particular, there's a lot of instances where this type of stuff is really important to take into consideration when writing stories. So while this was written for sort of a general audience, it's probably useful for journalists to have a look at this as well, because I think whatever area a journalist is working on, chances are they're going to be encountering a poll or a survey or a study at some stage where they have to interpret this information and make sure that they're getting the results across and not over-egging it or overreaching in terms of the way they present this information. So I hope that what I've had to say today has been useful. If you'd like to get in touch with me on Twitter, my handle is @CraigDButt. Thanks for your time.